Okay, today I'm presenting a treatment plan for a patient, a 17-year-old female patient who's recently diagnosed with systemic lupus erythematosus. She presented with pain, joint pain, fatigue, some photosensitivity reactions, a rash because of that. She also had some positive autoimmune lab findings that are consistent with the new onset of lupus. So that is why I drew out my SOAP note and wrote according to that diagnosis. However, I did include several other differentials. My primary treatment plan with systemic lupus would be basically to reduce that inflammation and prevent organ damage, improve daily functioning, and then, of course, provide long-term education to make sure that she has appropriate disease support management tools long-term. So the highest priority with this particular patient is going to be initiating her on hydrochloroquine. Hydrochloroquine because, again, that's what the rheumatology guidelines are recommending for pretty much nearly all patients with lupus. Hydrochloroquine is going to help decrease that disease activity and reduce some of those flares, improve her long-term outcomes, and then also hopefully safely help her as well. She does have a risk of some renal toxicity. That's a potential according to the ophthalmology, American Academy of Ophthalmologists, and therefore we would also have to recommend her ongoing eye exams probably every year. And then, of course, the second priority is going to be prednisone, and that's to help hopefully rapidly control that inflammation while that hydrochloroquine is actually kicking in, becoming effective. We would go with the lowest dose for her, and then, of course, with a steroid, you have to taper that, and we would taper her off of that too to minimize any adverse effects that you can get with prednisone, such as osteoporosis, hypertension, weight gain, hyperglycemia, metabolic syndrome, and increased risk infection. Lastly, pharmacological wise, we would want to make sure that we start her on calcium and vitamin D to support bone health, as especially while she's on that corticosteroid therapy. My highest priority, non-pharmacological priority, is going to be strict sun protection because, again, the UV light, especially here in Florida, is strong and it can trigger those lupus flares, so it kind of focuses around that. And then again, emphasizing patient and family education regarding management of medication adherence, recognition of worsening symptoms, infection prevention, and of course routine follow-up. Regular exercise, low impact is important, adequate sleep, healthy nutrition, and also mental health support because she is a young gal, so we want to make sure that we're addressing that as well with this chronic autoimmune disease. Again, we would probably refer her to pediatric rheumatology for long-term management, ophthalmology for the hydrochloroquine monitoring, and nephrology if we noticed any type of renal involvement. And then, of course, behavioral health for support regarding emotional strength due to her age, especially. And then possibly a registered dietitian to help with nutrition and health. So this case was fun. It allowed me to really advance my nursing knowledge and expand my clinical judgment, looking at the multi-system autoimmune disease rather than just treating isolating symptoms. So I kind of appreciated doing those things. And then again, prioritizing through the use of evidence-based therapies as well, and looking at the possibility of toxicity, which is very important in this case too. Okay, that's 5 minutes. Thank